I'm going to tell you a story about my life that explains why I'm so passionate about healthcare and medicine today. And here's a picture of me at 4 years old. And why is this important? Because my dad was a physician and his office was right in our home. And there were six of us kids. And I still remember when he'd come to the kitchen and he'd say, "Well, who wants to go on a house call with me?" And I always was the first one to jump up and shout, "Pick me." And over the years, I watched him practice medicine before insurance companies took over. This was before there were medical charts and before healthcare became a business. And today, I want to tell you what we have lost and, more importantly, how to get it back so you and your senior can have great medical care again. But here's the thing. If you don't know what you lost, you don't know what you're missing. Dad would take me into someone's house on a house call, and I'd have to sit on that plastic covered couch, which of course scared me to death. And he would go into the bedroom to see his patient and then come out and talk to the husband or the wife who was in the kitchen. And there was usually something on the stove, and they'd invite him to sit down and eat, which he always did. I never did because I didn't know what the food was. But on the way home, Dad would always tell me, "Don't tell your mother I just ate." And then we'd have a big supper. Well, one day I asked Dad why he never had charts. And he said, "What do I need charts for? I know all my patients. I know their brothers and their sisters. I'm a family physician. I've delivered some of them, and I see them around the community. So I know their good habits and their bad habits," which was true. He'd go to the weddings and bar mitzvahs and things like that. So he knew his patients. And if someone came in with a broken arm or a broken leg, all Dad had to do was pick up the phone and call his orthopedic friend, Marty. The nurse at Marty's office would put Dad through immediately. He'd say, "I'm sending a patient over." There were no pre-authorizations and no waiting. Marty would take care of everything and get back to my dad about what had happened. Dad did hospital rounds every morning at 5 a.m., where he met with all the other physicians as well as his patients. And they would discuss their patients privately. They'd share the specialties like surgery and what happened. And sometimes they'd even ask for second opinions from one another. There was always continuity of care. Dad always followed up with his patients with every hospitalization, and he knew exactly what had happened. So there was no guesswork or changing medications that he didn't think was right for his patients. He had total control. Let me give you an example of how an office visit worked back in the 1960s. When I got older, I actually did work in his office, and my job was to call the patients in from the waiting room. So I would go out to the waiting room that was always packed wall to wall, and I'd say, "Who's next?" And then I'd ask, "What are you here for?" And Mrs. Jackson would tell me that she was next, and she'd shout out in front of everyone what she was seeing the doctor about. This was normal. Then I'd have her come in and sit at my dad's desk where he was waiting. He'd take her blood pressure, listen to her heart and lungs. Usually, both of them would smoke a cigarette. Yes, my dad smoked, and the patient smoked too. The visit was usually about 10 minutes. That's how long it takes to smoke a cigarette. Then I'd have her follow me out to another desk where Mrs. Jackson would hand me $2 and she'd leave through a different door. I still remember my dad sometimes writing a prescription for Benadryl because it didn't go over the counter until 1985. That's another story about Benadryl's side effects. I worked in my dad's office when I would come home from college. And after college, I began my career teaching high school science and eventually college students. My brother and my sister, though, went on to become family practice physicians in their own solo practices. I went back to school at age 50 to become a physician assistant. And during my training, I saw how different medicine had become. I asked my brother and sister if they had noticed the change, that it was no longer a doctor-patient relationship. Insurance companies had planted themselves into that personal relationship, and it would never be what it once was. They said they didn't notice any difference. The reason? The changes came so slowly that they didn't recognize them. It was like the frog in boiling water. The frog put into boiling water immediately notices the change, but the frog in water that's slowly heated doesn't notice the change. I was the first frog. They were the second. They didn't see that healthcare was coming. Here's what we now have. Insurance companies now tell doctors whether you can get the treatment your doctor designed for you, like an MRI. They practice medicine in the form of pre-authorizations. Hospitals run the hospitals while your regular doctor has no clue what happened to you or if you've been stabilized on your own normal medications. How many times have I seen a patient return to my office on different medications, usually ones they can't even afford, so they never bought, and had to be restabilized on the medicines that worked for them all those years? Electronic medical records have replaced patient eye contact and examinations. How many times have we seen doctors sitting at the computer and never even looking at or touching the patient? I remember that the only thing my dad did was talk to the patient, watch them, touch them, feel them, hear them, see them, and yes, sometimes smell them. Now, seniors are left wondering why they even go to the doctor anymore, let alone if the doctors care. And I can't blame them. As many of you know, I worked in emergency medicine, internal medicine, and urgent care. My last practice was urgent care, where I saw 30 patients in a 12-hour shift. We got through COVID. It was difficult, but we got through it. And when my boss came to me after COVID and said, I need you to see 50 to 100 patients in a 12-hour shift, I decided I could not truly care for my patients anymore. So what did I do? I retired, like so many doctors are doing today. Sadly, I miss medicine tremendously. There is so much that could be taught to new practitioners, but they will never know or experience the value of patient contact unless they understand what it looked like before insurance made it a business, a for-profit business. We have lost the relationship between patient and doctor, and this was the very cornerstone of medical care. It was all housed in the conversation. I'm not saying everything was perfect then. We have better treatments now, better technology, better survival rates, but we lost something crucial. We lost the relationship. And for seniors especially, that relationship is the bedrock, the cornerstone of medicine. I see patients pushed aside. The minute they turn 65, they feel like Medicare doesn't care about them, that the system just wants them to get off the rolls as quickly as possible. Sadly, this isn't about preventive medicine, healthy choices, or better nutrition. It's about not truly addressing their aches and pains. It's about ordering more tests and imaging studies to get them out of the office in 70 minutes. Does anybody ever care? Currently, as a caregiver and advocate, I see that my family members' own doctors don't know him or the pain he suffers at all. They don't see that he's lost 30 pounds and is very frail. It takes forever to get in to see a specialist, and the appointments are now down to minutes, as I said. And I see that specialists never talk to primary care physicians, and I see that his chart is always wrong. And on a side note, I will tell you, I never saw in the 20 plus years of practicing medicine an accurate or complete medical chart. It was always wrong. Every single visit needed corrections. My family member has been hospitalized and sent home without any follow-up because there's no way he can get in to see his primary care physician for at least 6 months. He was given instructions but was so over-medicated on drugs he didn't understand or remember a word that was said. There is no connection between doctors who treated him in the hospital, usually many doctors in the hospital, and his primary care physician who needs to get him stabilized again. Well, let's talk about practical advocacy strategies and how to navigate the healthcare system today. Here's how to create a relationship-based care plan in today's world. Strategy number 1 is to become the keeper of your parents' story. As a caregiver, you are the keeper of their story. You must create a 1-page health summary, update it before or after every appointment, and hand this summary to every single provider, not the nurse in the office, but the provider themselves, and make them read it. Strategy number 2, request strategic appointment times. You must request to be the first or the last appointment of the day, preferably the first appointment, because the doctor is fresh. You'll have more time to ask questions and get valid answers, and your wait time will be less. Strategy number 3, build a relationship with one nurse or medical assistant in that office. The reason is that they are a lot less rushed than the doctor. They have direct access to the doctor, so they can advocate for you. They can identify who to connect with and what you need. They truly have the resources, so get to know them. Be nice to that nurse or that medical assistant. Strategy number 4, ask for a care conference. Ask for a care conference for your senior, and it has many issues, who has many issues, and the care becomes too complex. This might mean a virtual meeting with all the specialists. This is exactly how specialists used to talk to each other. It was just that they were at the hospital. Or it might mean that you need palliative care, where they bring together everybody in a room, the nurse, the social worker, the doctor, the clinical worker, and whoever else, even the pharmacist who needs to be there in the conference so that the needs of the patient, your senior, your loved one, are met. If you need an alternative to today's failing system of medical care, I have a huge suggestion for you. More and more of us are turning to this option, and you need to know about it. There are physicians out there called direct primary care physicians. They are not concierge doctors. They are doctors that charge very reasonable prices for you to be their patient. Insurance does not pay the fee, you pay the fee. The definition of a direct primary care physician is that they do not work with insurance. But the good news is your insurance company will still take care of any hospitalizations or lab work that you need done or medications you must have. These physicians or doctors charge a nominal fee from $55 to maybe $150 a month, depending on your location, your age, or your diagnosis or complex issues. What they do is spend an hour with you and they get to know you. That's every visit. And what they do is they give you their cell phone number so you can text them if you have a problem. You don't have to be seen unless you want to. They can talk to you over the phone because they know you. They know your family. They know what you're up against. They understand the issues. They are truly the best of the 1960s doctor. Concierge doctors, on the other hand, do take insurance and the self-paying patient. So what this means is because insurance pays so little in reimbursements, these concierge doctors have to supplement the low-paying insurance reimbursements with high-paying patient revenue. This is why a concierge doctor will charge so much more than a direct primary care. In fairness, their care is as good as a direct primary care. However, you may have to wait to get in to see them or get a call back because they are seeing insured patients. They just have more patients to deal with than the direct primary care physician does. Okay, direct primary care physicians normally work on their own and in their own private offices, or maybe with 2 or 3 other direct primary care physicians. They are not owned by a healthcare facility, and typically their monthly fees, as I said, was $55 to $150 a month. Concierge doctors who take insurance are usually owned by a healthcare facility that directs them how their practice is going to be run. Typical fees are $250 to $5,000 a month. They are also called hybrids. So to recap, either implement these 4 strategies above into the healthcare system for your senior, or consider looking for a direct primary care physician. Go and interview them, which they are always open to doing, and find one that suits your senior's needs and preferences. This is what seniors really want. They want to go back to the 1960s, a classy form of true medicine. And you can find the direct primary care physicians at mapper.dpcfrontier.com. We've lost something precious in healthcare, the relationship between the doctor and the patient, but it doesn't have to stay lost. Whether you use these advocacy strategies to work within the current system, or you find a direct primary care physician who practices medicine the way it should be practiced, you do have options. You can always look for a patient advocate as well. Your senior loved ones deserve to be known, to be heard, and to be cared for, not processed. They deserve a doctor who knows their story, who takes the time to listen and treats them like family. That's the medicine I grew up watching. That's the medicine we can bring back. Take care. We'll talk soon in the next video. Bye-bye.